Right. So let's say you're in a situation where you're pulling 2 premolars. You're going to do the blood work before you do it. You were just doing an annual dental when you discovered it. That's where you're at. What am I talking about money-wise?
Depends on location. Sorry.
Let me
give you a range. Let me give you a range. Just in Las Vegas, I would assess a routine grade 1 periodontal disease, routine cleaning, no extractions, just in and out, to be around. They have dental specials often.
I don't want to talk about the specials yet because we're going to get about.
But you need to understand that. Yeah, you got to understand that though.
I want to know what the regular price, what the real price should be.
300 to 500 is your average. That's your average if you're doing it right. 300 to 500, I would say that's being nice. And then you're talking about with disease, and depending on how many teeth have to go, they can range from 500 up to, $3,000.
So the point I'm trying to make, because as I'm listening to you talking, we're talking about what's in it, right? I'm thinking about it like a car, right? If you suddenly have something that costs from 300 to 500, or could even go up to the thousands, and you're talking about just the basic, and you're saying, hey, here's a dental special, it's going to cost you $80. You got to understand
what comes with that special.
What comes with the special, right? With the $80, what is that doing? And then is that $80 mean that somebody just looked in your cat's mouth? And then now if you need anything truly done, there's going to be some added options that have gone to that package? Because I mean, that's a part that we as pet owners, that's what we have to struggle with, right? When we suddenly have, I didn't expect to spend $500 in this cat that I adopted for $80.
Yeah, that's a good assessment. And this is where a lot of your history comes in, how often you've been to the vet before or prior to, because we're going to have that physical exam. And if your cat allows me to look in that mouth, sometimes I can assess, hey, these couple look problematic. Or if the cat won't let you in, like, I'm not letting you touch my mouth, that already tells me, on top of your history, and your history may consume of what? Never seen a dental. This is his first time getting a cleaning in 10 years. He's 10, so what? All right, I guarantee you disease is in that mouth. So let me go ahead and high rate you on the high end. And if it's lower, amen, right? But I don't want to give you a price that's super low, $80 out the door. That doesn't make sense for a cat that's never seen a doctor. Right? That's never had a dental cleaning, that you don't brush your teeth in a decade. It's some diseases there. So the grace period is, let me go ahead and quote you high, and if we're any lower, we got it.
Just like you're not going to get a brand new Benz for $12,000. Ain't going to happen.
Not going to happen.
Ain't going to happen.
Not going to happen. So realistic expectations, again, are your key component. But understand accountability, too. If you didn't do it, we can't be mad at the situation. Let's focus on the problems, and it's us versus the problem. Right? Gotcha. And once you remove these problems of the mouth, the cat is flourishing after. They do so much better. Gotcha. And you'd be surprised how that mean cat is no longer mean anymore. Wow. Magic. Yo.